My name is Michaela and I'm a researcher from Swansea University. I specialise in child health and in particular physical activity in young people. The Active project has been a project that I've managed, and Active has explored ways to get teenagers more active. What I'm going to talk about today is some analysis that we did using the baseline measures from Active, and that's how physical activity and fitness is affected by a teenager's built environment. So just for some context, we all know there are huge benefits to being active. However, many young people aren't active enough. So these guidelines suggest that young people should be doing 60 minutes of moderate to vigorous physical activity per day. And this can be in the form of playing, games, sports, active travel, or planned exercise. So the ways in which you can do MVPA are really broad. Teenagers say that they aren't active enough because of accessibility barriers. They just cannot access the activities that they want to. So for example, there's not enough cycle paths, bus timetables are too complicated to read, the bus fare is too expensive, or there's no activity provision that they want to do, or that the quality of some spaces, the quality of some parks or green space or activity providers is really poor. And in some cases, they just don't feel welcome in their communities. And we know this because this is what teenagers told us as part of Active. Previous research using physical activity as a measure has showed by improving access to things like parks and pathways and gyms, it positively impacts physical activity. And we should be creating environments that encompass all this, and environments that facilitate physical activity and make it easy to be active. Because Article 31 of the United Nations Convention on the Rights of the Child say that every child, and this includes everyone up to the age of 18, has the right to play. So spaces should be facilitating this. So we use baseline data from the Active project to show how the environment impacts teenagers' physical activity and fitness. And we did this through mapping. So we recruited 270 participants from year 9. This is teenagers aged between 13 and 14 from 7 secondary schools in South Wales to take part in this particular part of the Active project. So we collected measures on physical activity. We got teenagers to wear accelerometers on their wrists, and they can tell us how much physical activity that teenagers have been doing. And that ranges from sedentary behaviour, light, moderate, vigorous. And we encouraged teenagers to wear the accelerometers as much as they possibly could over 7 days, so we could get an indication of physical activity over that time period. We collected fitness data using the Cooper Run test. This is a 12-minute walk-run test where we asked teenagers to complete as many laps of a sports hall as they possibly could in that 12 minutes. And then we mapped teenagers' homes and schools against distances to active travel routes, public transport, activity provision, and natural resources. So natural resources meaning parks and woodland green spaces effectively. So what we did is we put all of their homes, all of their schools in a map, and then we could look at how close did they live to things like cycle routes, how close did they live to bus stops, how close did they live to things like gyms. This meant we could explore how the proximity to these things in a teenager's local environment impacted on their activity and on their fitness. So what did we find? In terms of physical activity, we found that teenagers had higher MVPA if their homes were closer to public transport. And this was particularly the case for girls. There could be 2 reasons for this. So the first reason being that teenagers are willing to travel to do things that they like. So they're willing to get on buses, to travel outside their communities to be active in other places. There might be things that are more attractive for them to do away from their homes, away from their schools. And the second reason being that those living closer to these public transport links might not have a car, their family might not have a car because it's easier for them to use public transport, and therefore they might engage more in active travel. So they might be walking or cycling to places a little bit more, which might mean that their physical activity is a little bit higher. Interestingly, as MVPA increases, so does sedentary time. And that sedentary time meaning periods of physical inactivities. And this is especially the case with boys. So this is an interesting thought. What do we want more? Do we want these big spikes of MVPA, or do we want more of a flow across the week? In terms of fitness, teenagers were fitter if their schools were closer to natural resources. So if their schools were closer to green spaces like parks and wooded areas. It could be that schools near green spaces may be able to provide better provision for PE lessons. They have more space to be able to do PE, and they may be able to provide better outdoor break time. All of these may improve overall fitness. And green spaces may also provide a safe place for young people to cycle or spend time with their friends after school. It might be that because these schools are in less urban, built up areas, they're away from high traffic, and this might make them feel safer to be able to use these spaces independently. And this is particularly the case for girls. And interestingly, we also found that more deprived pupils were fitter. So those coming from more deprived backgrounds actually had higher fitness levels than those from more affluent areas. So what are the impacts of the built environment on a teenager's physical activity and fitness? So teenagers were more active if their homes were closer to public transport, and this possibly indicates that they are willing to travel further to be active. So therefore, giving them the opportunity to travel independently to be active is essential. There needs to be easy infrastructure for young people to access. This means that we need to keep the cost low so that they can afford it themselves, or that we need to make bus timetables easy to read. And if we can't facilitate independent travel, we need to give teenagers the opportunity to stay closer to home. So making them feel welcome in spaces, or make provision more suitable. And you can make provision more suitable by asking them. And we also need to consider the impact of schools being near green spaces on fitness. It might be because they have better PE, break time, or classroom provision. Unfortunately, this means that some schools are by nature better suited to nurturing physical activity and fitness, and that some schools that are more urban, more built up, might be at a disadvantage. And although it's not a direct impact of the built environment, the fact that sedentary time increases as physical activity does is an important consideration that we need to be thinking about. When we think about getting teenagers and young people more active, we often promote sport to them. Is sport the right vessel to be focusing on to get young people more active? Do we need to focus on activities that have a more light to moderate physical activity level, so that we can keep this activity sustained throughout the week, rather than teenagers feeling that they need to rest and recover in between? If teenagers are travelling away from their homes to be active, we need to create provision that teenagers want and need in their local areas, or make it accessible for teenagers to travel independently. We also need to consider the school grounds as really important spaces for physical activity and fitness. Currently, school grounds are underutilised. There are already facilities in communities that are designed for young people that are just being underutilised. So we need to work out a way that teenagers can still access these spaces in a way that they want to. So if more deprived teenagers are fitter, what can we learn from this? So we could learn that we need to make environments and the spaces that teenagers live and go to school in really easy and accessible to be active. So things should be really low cost, and then we should look at promoting and maintaining active travel, such as cycle paths, pavements, and car-free zones, as well as really easy, accessible activities. So for example, we should be allowing teenagers the space to play and hang out with their friends. We should be giving them a space or a place to go and be able to do the things that they want. And we can relate these findings to our current climate. So during lockdown, we were given allocated time to be active in our local communities. But if our local communities aren't activity friendly, what are we supposed to do? And I think this is something that the coronavirus pandemic has highlighted. So how can we create more opportunities to be active? So for example, creating more space for young people to dwell, play, and connect with their friends and family. And we've been seeing more examples of play happening out in our streets. And we need to keep this. We need to keep this ethos. We can't just forget about it once we're out the other end of lockdown. We need to consider how important our local streets are to being active and creating those play opportunities. As well as this, we have shown how important schools are. So this can feed into return to school measures across the country. So if teenagers are living in spaces that aren't particularly activity friendly, how can return to school measures ensure that we bring that activity back up? And I think this is going to be a vital part of returning back to school. So what's the take-home message of this study? Our communities and the provision inside our communities are helpful when being active and promoting activities. And we need to consider these more seriously if activity and, more generally speaking, health is high on our agendas. So we need to stop creating communities for cars and create them for people. So that means better access to public transport, active travel infrastructure, access to green space, and bringing activities that teenagers want and need closer to schools and homes could make a significant difference to teenage health. And ultimately, these environments should focus on bringing provision that teenagers want and need into local communities. So you can't just place any old activity or any old sport in a community and expect that it's going to be successful. It needs to be something that teenagers actually want to do. And this provision should include different types of activities. So it should include light activities, moderate activities, and vigorous activities, as there is a conflict between improving MVPA and increasing periods of inactivity. I would argue that creating more sustainable physical activity and something that you don't have to recover from, something that's a little bit more enjoyable, that you don't need to rest from, would be of huge benefit, not just to teenagers, but to the health of everyone. So thank you very much for listening to my presentation. If you have any further questions, you can email me or Sinead, who also led this research, on the 2 email addresses below.